Hello, everyone. I'm Melissa Budzinski with Gilda's Club, Grand Rapids, and it's great to be here together with you. Hope that all of you are staying safe and you had a good and safe spring break and you're back in the swing of things. And with spring here and the beautiful flowers and the trees blooming, it just feels like hope is in the air. And I hope that you can find some hope in that also. If you're new to Gilda's Club or to Facebook and you'd like some more information, we'd love you to reach out to us. Just like this post or make a comment on this post. If you have a question for my guest today, or you want to be part of the conversation in the moment, please just post that and we'll make sure that he gets that. So today I have with me Dr. Adam London he's Administrative Health Officer of the Kent County Health Department of Grand Rapids, and he has been in that role since 2013. Adam earned his BS in Industrial and Environmental Health Management from Ferris State University, a master's in Public Administration from Grand Valley State University, all right here in West Michigan, and his PhD in Public Health and Epidemiology from Walden University. In addition to his role at the health department, he also teaches courses in public health and administration at U of M, at Michigan State University, Grand Valley State University, and Western University. That's a busy schedule, Dr. London. Adam is also registered sanitarian and diplomat of the American Academy of Sanitarians. He served as the president of the National Environment of Health Association in 2017 and 18. And since March of 2020, Adam has filled the role of incident commander for Kent County's public health response to the COVID-19 pandemic. Wow, that's quite a mouthful. That's quite a resume, Dr. London. It's so great to have you with us. Thank you for being here.
Thank you, Melissa. It's so good to be here with you and with Gilda's Club, who is just an amazing organization doing incredible work in our community. And we're just so blessed and fortunate to have good partners in this community like this. I speak to colleagues from around the state all the time, and they don't have the same level of support and the same level of partnerships in the community that we have in Grand Rapids and West Michigan. And so thank you to all the work that you do and to all the work that everyone listening and watching today has done over the course of the past year to get through this pandemic. You have made a difference. I have no doubt whatsoever about that. There are people who have gotten through the last year, who have survived the last year, and who have avoided long-term consequences of COVID because of the work that you've done. So just thank you to you and to everyone here today.
Oh, well, and I really agree with all of those sentiments. And then I want to send back to you all the work that you have done and all of you at the health department in really helping us collaborate and stay together on this journey of health and staying safe, and just really appreciate your time, effort, passion, all the work that you have done over the past year. It's really incredible. So thank you. And please thank all of your colleagues from all of us at Gilda's Club and in the community.
Yeah, we'll do that. We really have an amazing team. And we have a team of people here at the health department and in healthcare here in West Michigan who have taken this personally. It's not about some problem somewhere else. It's about their family, their friends, their neighbors. And I just tell you from the very beginning, when we heard about coronavirus and we realized it was going to come everywhere, there are people who just said, no, not here, not in our community. We're going to do our damnedest to make sure that as many people as possible get through this and aren't hurt by this. And it's just been a calling to them. So I'll pass that along, but back to all of you again. It's been a team effort, and by team, I mean everyone who lives, breathes, and resides here in West Michigan have had a role in this. So thank you.
Yeah, I would agree. And, here at Gilda's Club, we often say our tagline is, in this together. And I really feel like that all over Kent County and far reaching from that, that we really worldwide, we're in this together. And it's gives such a balance to that place of sometimes needing to stay isolated or socially distant, but really we're doing it all together. And so this virtual platform, able to stay connected and have these great conversations. So yeah. Well, our topic of conversation today is cancer and the vaccination. And we've asked our community to send us questions. And so we've received lots of questions and are excited to I'm going to say, start this conversation with us, because I know it could go on much longer and we'll just continue, as most conversations, most investigations of things, that it'll create more questions, hopefully, also, and so that we just can continue searching out the answers for these. So to begin with, I just wondered, how many have we vaccinated in West Michigan so far? Let's talk about that positive thing. How many have we gotten in arms already?
Yeah, so that's the great news. And we've heard an awful lot in the past few days about the bad news with numbers.
Yeah,
But here in Kent County, 30% of our population 16 and older is fully vaccinated.
that's awesome.
Yeah, we're 30%. And that's shocking to think that in the course of just a few months, we've got 30% of that 16 and older population vaccinated. And another 20% are partially vaccinated, that they've had that first shot and they're waiting for their second dose appointment. So, we have made huge progress. Right now, we are administering about 50,000 doses of COVID vaccine every week here in Kent County.
Oh,
And
wonderful.
I think we're leading the state, or we're right at the very top of the state as a county right now. We're several percentage points above the state average in those areas. So we really, I think we've done a lot of work bringing partners, the pharmacies, the hospitals, the county to make vaccine, the small clinics like Cherry Health, they're not really small, but the smaller clinics, to make vaccine available and make the staffing available. Our challenge has been getting enough vaccine. We're starting to see that improve, at least we were until the unfortunate Johnson & Johnson situation. But we're well on our way. And we really need the community now to do their part, which is to take that opportunity for the very first vaccine appointment that comes to you. And by doing that, we can all beat this together.
Oh, that's great. Congratulations. That's a big pat on the back, and leading in our being up there with the numbers in our state. That's awesome. Yeah, that's really great.
It feels good that we can finally, after a year of telling people what not to do with avoiding gatherings and so on and so forth, it feels really good to everyone in public health and in medicine to be working together and going on the offense and doing something to take the fight to COVID. And it feels like we're really accomplishing a lot there. We just need people to come for that vaccine appointment. And we need people to hold on to those disciplines that have got us through the past year for a little while longer, so we can get through this current surge and get to that point where COVID isn't the problem that it is today.
Yeah, well, that leads me into the next question, and specifically to people that have either have had cancer, they're a survivor, and maybe they're a little ways out. And so this is a kind of a two-part question. And then those people who are currently in treatment for cancer, are there special considerations or recommendations around vaccination if you have that situation?
Yeah, so there is not a contraindication with the vaccine and with either having cancer. In fact, we really recommend, encourage people who do have cancer to get vaccinated. That is going to put them in the best position to avoid COVID, which might complicate their recovery and their fight in other aspects. Now, I always want to encourage people to speak to their own provider if they do have questions or concerns. And I want to again mention, I'm not a physician. I am an epidemiologist. So I'm not giving anyone specific medical advice for their own care. But Generally speaking, we do recommend a vaccine for anyone who is fighting cancer or recovering. We just want to make sure that they do have those conversations if they are concerned about that.
So first, maybe talk with your physician, your oncologist, whoever is administering treatment, get that okay, and then proceed on to wherever is safest to get their vaccination.
Absolutely. Yeah, and again, we haven't heard of any contraindications or any reason at all to think that that vaccine would be a problem for people who are fighting cancer or recovering from it. We have this question about whether immune suppressants or people who have autoimmune illnesses or blood cancer, how that might relate to the vaccine. Right now, the recommendation for all of those persons is also to get vaccinated. There is some question about whether the vaccines are as effective with those populations as they are with the general population. That's still a bit of an open research question. There's some evidence that suggests that maybe there is less of an immune response, less antibody response development to the vaccine in those cases. It's unclear if that lessened response is still sufficient to prevent illness or infection or not, but certainly there's no reason to not get the vaccine. Those research questions are going to be studied further, but right now, generally speaking, we are making that recommendation to everyone. Please get that vaccine.
Okay, all right. And so that leads me to this next piece of after you've had your vaccine, are there particular precautions or behaviors that we should think about after we're fully vaccinated? And so it's you get your vaccine 2 doses and then 2 weeks, correct, of just regular isolation precautions. And then beyond that 2 weeks, are there special precautions for people who are in treatment or have a cancer diagnosis?
Well, we really want everyone to be careful because while vaccines are very, very effective, and the Pfizer and the Moderna vaccines both have an efficacy above 90%, that's still not 100%. And so we still want people to recognize that there will be situations where vaccinated people did become infected and in some cases became actually ill. And so that's a reality that we want people to have in mind. We do believe that we have enough people, or when we have enough people vaccinated, that overall risk of transmission of virus becomes low enough that it's not preventative to getting out and to reclaiming life as usual, like we'd like to do. But in general, we want people to continue for whether they're fighting cancer, have an underlying health condition of a different type, or just a general population. We really want them to continue to avoid large gatherings. We want them to continue to wear facial coverings in public places where other people are gathering. Take those precautions. That's general guidance right now for everyone for the time being. We've got a lot of people who think that I get vaccinated, I wait my 2 weeks, I'm bulletproof now, I can go and I do whatever I want. And that might be too strong of a conclusion to draw because no vaccine is 100% effective. And we really just need to do everything we can, especially those easy steps, to make sure that we're stifling the spread of this, especially when these numbers of new cases are so high in the community.
So it makes me think about this new variant that has hit West Michigan and specifically really Kent County too, is the vaccination, what's the, I want to use the word efficacy, and I'm not sure if that's correct, but for this new variant in the vaccinations that we have?
Yeah, so that's a great question, Melissa, and it's one that we've all been very interested in as well. The data thus far indicates that the Pfizer, the Moderna, and also the Johnson & Johnson, but the vaccines that we have are highly effective against the B117 vaccine or virus variant rather. And also, we've got a number of other variants that have popped up. We've got the South African. We have the California, there's an Indian variant. There's a number of them that have been in the news lately. And we expect that's going to happen. As an RNA virus, it doesn't have like a spell check with its genetic code, and so it's more prone to errors than other viruses. But the key is, if we can get overall immunity in the community to a level to slow down the transmission, then we're much better positioned to prevent future mutations and also the spread of any variant. But we are concerned about it. The vaccines are effective, but we need to get a handle on new cases so that we don't continue to overwhelm or push our hospitals to a spot where they are overwhelmed.
Right. And that probably comes then with all of the sticking with the protocol if you've traveled anywhere, because those variants are out there and we can bring them back if we've traveled somewhere, and to make sure that we're doing our part as far as keeping everything contained.
Yeah, and these things, they spread so quickly around the world. It's very difficult to stop them altogether. And that's a challenge that we're all faced with as well. And how do we going forward really create systems that slow down the spread of these types of infectious illnesses in a world that's so well connected and so well traveled?
Yeah, that's a big challenge.
It is.
Okay, well, I'm looking here at my questions, and let's see. Oh, that's one where we're at too, is after being vaccinated in the 2 weeks, can you still carry the virus with you? Can you still be a spreader?
If you have been vaccinated, there is a possibility that you could become infected and could spread to others. It's a slim possibility.
Okay.
It's probably well less than 10%. It is a hypothetical reality, but it is pretty slim. That was a concern for a while. You know, we knew early on that the vaccines prevented illness, but wondered, do they stop infection as well? And so could vaccinated persons kind of be invisible spreaders? The research we have now says that the vaccines also prevent infection to that high 90+% rate. So while it is possible, it's unlikely, and when it can do that, it's not as effective in spreading amongst vaccinated persons. So if we can get everyone vaccinated, or that vast majority of people vaccinated, we're going to make that really a moot point.
Oh, that's great. That's really great to hear. Because I'm thinking especially of people who might be caregivers or supporters of someone who is currently in cancer treatment, or even the elderly or whatever. They might be a caregiver by profession or by family connection or friend connection. And so, that piece of spreading and is really important. And I would assume too in the healthcare field, right?
Oh, absolutely. I'm so glad you brought that up, Melissa, because there are so many people that have a real challenge getting to the vaccine, especially the homebound.
Yeah.
And we're working on solutions to that, but that's a really heavy lift. In the meantime, if we can surround those persons with vaccinated people, we can really do a great deal in protecting them while we figure out ways to get vaccine directly to those persons.
So if you're a caregiver or a supporter of a person, it is really imperative that you get your vaccination so that you can be that safe place for that person, and then maybe help them get to their vaccine, by transportation or whatever means. I know that myself and some of us at Gilda's Club have either helped people sign up that were having difficulty. This is when it was more that 65 and older, or we would drive people to the vaccinations if they didn't have transportation, just so that we could really be as helpful to our membership as possible to get their vaccinations when they desired that. Yeah.
Thank you so much for doing that. And I would really encourage everyone else who is in a position to do that. Please help your family, friends, and neighbors navigate an appointment. It's a lot easier now to get an appointment, and the system is much better designed now than it was months ago. And if you can drive them to their appointment and make sure that happens, that's a huge win for our community. Right now, as I mentioned, we are working with EMS and with home visiting nurses and others to try to build systems to get to the homebound. But it's a big, heavy lift. In fact, I think it's probably been the greatest challenge so far is trying to figure out how to do that. We can do huge quantity and lots of efficiency at our clinic at DeVos Place and pharmacies and elsewhere, but getting a healthcare provider to an individual in a home, that's really resource heavy, and it's tough to do that.
Yeah. And I'm sorry I don't know the answer to this because maybe you've already advertised, but I wondered this summer, are you going to have mobile units that will go out to neighborhoods where people can just, maybe it's a block walk or across the street that they could do that?
Yeah, that's part of the game plan. We've got a few beautiful mobile units that we've been able to acquire with CARES Act money. That we will be putting to use in communities and in locations where we know that there are a large number of people who have transportation limitations or who have ability limitations. And so we're going to be doing that. Right now we're focused so heavily on these massive, large clinics trying to get the quantity of vaccine in the community as high, as quick as we can.
Sure.
And now we're trying to also focus on equity and making sure that we're locating vaccine resources in places that are more targeted, more strategic, and our mobile units are a big part of that, along with some of the small clinics we've been having at community centers and churches and in different locations that are well known in neighborhoods, so we can make vaccine available like that as well. But that's going to be a really big challenge going forward is, once we get past the heavy lift of the next few months at these large centers, is how do we make sure that we then make vaccine available in an ongoing way where it's the most needed? And of course, our pharmacies and doctors' offices are going to be a big part of that solution as well.
Oh, absolutely. Oh, yeah, that's great. Oh, I'm glad to hear that. It's encouraging news, especially for people. Transportation is a big issue, and especially if you don't want to be out in the public. And so it really is a challenge. And so I'm glad to hear that mobile units or specific, neighborhood kind of unit places will be available. Yeah, that's great. All right. So somebody asked, what if you changed insurance in the middle of this? What if you don't have insurance? What should a person do?
Don't worry about it. Don't worry about it one bit. Please just get an appointment and come down and visit us. You will not be charged a penny. If you do have insurance, we will bill that insurance for the vaccine administration. But if you don't have insurance, or if you're in between, or if you forgot your information, don't worry about it. You will not be charged anything. So please don't let that be an impediment.
Oh, great. And if your insurance is charged, are you going to be charged a copay?
No.
Or that's waived?
Yep, there will be no copay. There's no charge out of pocket for anyone for the vaccine.
Oh, that's wonderful. That's really great. It just shows how important this really is and how much there is behind really just getting those vaccinations out there. That's great.
Yeah, and we appreciate the support that we've received from the state and the federal governments to make sure that we have the resources available to us so that we don't have to worry about that kind of thing. Because honestly, that even just the time in billing and all of that, that would slow down the works. And right now, we need to be focused on how do we create a vaccine campaign that is as low risk as possible and is accessible to everyone. And that's what we're focused on. And I'm not worried one bit about the money at this point. We know we've got that covered through a number of large federal and state actions that have been put in place. So don't worry about that. We're not going to charge you anything.
Oh, great. Oh, good to hear. Thank you. So how long does the vaccine last? And so and in addition to that, I guess, and if you want to wrap in, is what does this look like for next year? Are we gonna have to be, is this gonna be a yearly vaccine? What does the future look like for this?
Oh my goodness, Melissa, I wish, I think we all wish we knew exactly what the future is going to look like. What we know so far is that the vaccines that we have retained their value over the course of the last 6+ months, which means, we've only had them for about 6 months. And those people who were vaccinated 6 months ago still have a much lower incidence of COVID-19, still are demonstrating that high rate of efficacy. So we know at least 6 months. It's hard for us to say with certainty beyond that because we just haven't seen humans with this vaccine for longer than that.
Okay.
So researchers around the country and the world are watching that very carefully to look at antibody levels over time and incidence of illness over time. I think we're all hoping for as many months, as many years as possible. I think it probably is likely, especially because of the rate at which variants evolve, that there will be a booster or a follow-up with some regularity. Whether or not that's every year or every 2 or 3 years still remains to be seen, but there probably will be. I'm hoping that there's a way that we can combine that booster with the flu shot. I think that would be the best outcome for everyone if we could either create in a combined booster or a combined shot or even 2 at the same time. If there's a way that we could find a way to make that happen, that would really protect against these 2 monsters of coronavirus and influenza at the same time.
Yeah, and is it true that the incidences of flu virus have been way down this year?
Way down, which is another interesting research question.
Yeah.
I think we all can see that in addition to influenza, other types of respiratory viruses are also way down. So certainly the social distancing, the facial coverings, the hand washing, all of those things are playing a factor. I think another factor involved is the greatly diminished international travel. And so influenza kind of fluctuates from southern hemisphere to northern hemisphere every year. And without all the travel between the hemispheres, there's far fewer humans carrying virus from one zone to the other. Now, that's not, we want to make sure we can travel again in the future.
Yeah.
So that's probably going to go away. But it does make us wonder, is there value in having a recommendation with things like facial coverings during flu season when you go in public places? That might be something that we see in the future is, we may see, facial coverings for a while longer.
Sure. Well, and I'm not sure I'm completely right about this, but in China, they've been wearing facial coverings for a long time, years and years and years. And I don't know if maybe the flu or other communicable diseases are lower. There's a lower incidence because of that. They do it a lot for, I think, for air quality. But I just wonder if, because I think it's been a practice, Japan and China for a long time.
Yeah, it has been. It's hard to compare incidence rates from country to country because many of the cities in China and in Japan are so tightly populated.
Sure.
But they have recommended that for a while there. Now I don't. I hope no one misconstrues and thinks that we're gonna have requirements to wear facial coverings from now until forever. That's not gonna happen. So don't think that. But it may be a recommendation during flu season, or at least during the more concerning parts of flu season, to wear a facial covering in order to better protect yourself when going into a crowded public place, such as what they do in East Asia.
Yeah, well, I certainly have heard people talk about the practice of wearing facial coverings for as long as they can, that they want to do that, especially during, high times of, in the winter here, when we're closed in and having to go into the store or whatever. But, and now more comfortable doing that because of all the practice we've had, right? We've certainly built a lot of skills over the past year.
Right.
Yeah.
And there's certainly no harm in doing that.
Yeah.
There were some people early on that said, you can't wear these facial coverings, you're going to cause lung infections and so forth. And I speak to the infectious disease experts at hospitals all the time, and I ask them, are you seeing an increase in the number of people with lung infections because of face masks? It's not happening. No one has seen those patients, so it causes no harm to wear a facial covering. And I think, to your point, Melissa, I think that a lot of us have gotten very, conditioned to it, and it's no big deal.
Right. Yeah. So that's a good thing. It just shows how teachable we still are, how adaptable we still are, and how important that is, and how we can build these skills of resilience and helping all of us move forward in that positive way, because it really is a simple way to really protect yourself and other people. That washing hands. Yeah.
So simple and so affordable now, and especially now that we have the infrastructure to make items like masks and the PPE and the sanitizer. I think we're in a lot better position now than we were a year ago to protect ourselves and our neighborhood from things like influenza and coronavirus.
Yeah, I would agree. Oh, this is great. I'm just going to check my questions here. And I think that we did really good. And I think we hit just about all of the questions, which is great. And just really, really appreciate your time. I know that you're very, very busy and you've got a lot on your plate, and really appreciate you taking the time to be with us today and to speaking to our members and talking about this really important topic of the vaccination and with the implications of having a cancer diagnosis.
Well, thank you for the opportunity. And it really is an honor and an opportunity to talk to you and to everyone today, and to ask you for your help, because we know that one of the major things that people think of when they decide about whether or not to get something like a vaccine is, what do people that they think they respect and they think highly of, what do they think about it? And so if everyone here could use their influence when talking to family members and friends, encourage them to get vaccinated, that would help us all out greatly.
Yeah, that's great. Yeah, well, I'm fully vaccinated now, and I'm just so grateful for that. And I've had coronavirus in addition to that. And so felt really good to be able to have that vaccination. So thank you very much for bringing that here in my family and my mother. And we're just all really grateful to be able to have that step of the vaccination. So if anyone, you're welcome. If anyone out there has more questions about the vaccination, we're going to post Vaccinate West Michigan site right here on our website, or it'll be on our website and our Facebook page, and also the health department website. And so reach out and ask questions. If you want some help with that, all of us at Gilda's Club are just happy to help you to get connected, to get to answer some of your questions if we can, or to help you get those questions answered. We also wanted to let you know that we just found out yesterday that this great opportunity on Thursday, April 20th from 6 to 7 p.m. There is a collaboration with Cancer Support Communities in Ann Arbor, with the Gilda's Club in Detroit, with U of M University and Carmanos Hospital, and it's going to be a specific webinar about cancer and the vaccination and the coronavirus. And so it will be something you won't want to miss. And I think that they're also going to be fielding questions there during that time. So we'll post that flyer on our Facebook page, and it'll also be posted on our website. If you have questions about that, go ahead and get a hold of us at 453-8300. We would love to make sure that you get that flyer so you can view that. And if anyone viewing today is new to Gilda's Club and new to a cancer or a grief journey, we would love to get you connected to our free cancer and grief support. Just give us a call at that 453-8300 or look on our website. You can send us an email. That website is gildasclubgr.org. And we hope that you all stay well, stay connected, and get your vaccine. And again, Dr. London, thank you so much for being with us.
Thanks, Melissa. Thank you, everyone.
All right. Take care, everyone.